نرجع نعيد ولا؟
معليش دكتور، لا تقدر تبدأ على طول تكمل.
Okay. So I want to elaborate that Royal College of Physicians of Ireland, it's worldwide known. It's over 350 years, almost 400 years age. Many doctors are graduated from there in thousands, and they are distributed worldwide, and they are keeping good connection with the Royal College. And many famous Irish doctors are in the history of Royal College of Physicians of Ireland, contributed to the science of medical education and the practice of medicine. So, في البداية, first I want to express my thanks and appreciation to the Saudi Cultural Bureau in Ireland for supporting the Saudi Doctor Society and graduate doctors and doctors in training and all undergraduate medical students. And special thanks to the Saudi Doctors Society for inviting me. I'd also want to mention my sponsors, Ministry of Education in Saudi Arabia and Taif University. They supported me through my journey. And special thanks to the RCBI and to my professors, trainers at St. Vincent University Hospital in Dublin and the Combe Hospital in Dublin and many other hospitals in Ireland I worked in, and I had rotation and study days in many hospitals, so I have experience on those, but I don't want to mention one and forget another one. So I have my sincere thanks to all of them. So first of all, I want just نوضح. Do you want me to proceed in English or Arabic, or what do you prefer?
أتوقع ميكس عربي وإنجليزي الأغلب يفضل فعادي.
Okay.
هو يعني التارجت راح يكون أطباء سعوديين، فإذا كنت بالعربي يكون عادي.
Right. So I want just أول شيء لازم نعرف يعني RCBI, what do we mean by RCBI, because there is difference between the governance of RCBI training programs in Ireland and in Saudi Arabia. Saudi Arabia, we are all under the umbrella of Saudi Society, Saudi Commission for Health Specialties, الهيئة السعودية للتخصصات الصحية. لكن التدريب في أيرلند ممكن في الجامعات أو الكليات الطبية، ممكن under the umbrella of RCBI. ال RCBI, they have training bodies, and the faculties are under RCBI are pediatrics, pathology, occupational health, ops and gynae, and public medicine and Institute of Medicine. Under the Institute of Medicine, you have the fellowships in the programs of medical subspecialties like hematology, endocrinology, respiratory medicine, and others. RCSI, the Royal College of Physicians of Surgeons, they supervise the surgical subspecialties. There is Royal College of Ophthalmology. They have also a position, I think one position is for the Gulf. So أي واحد يبغى يتخصص في طب العيون يقدر يقدم عليها. الأنستيزيا والراديولوجي, I think they are also under RCSI. الريزيدنسي بروجرام عندنا قبل التخصصات الفيلوشيبس اللي هي الميديسين. في ايرلند في ممبرشيب اكزام ممكن تسويه خلال اي تدريب عندك او خلال التدريب الريزيدنسي في ايرلند. اي سؤال على البروجرامز قبل ما نكمل او
ممكن نكمل على البروجرامز نفسهم ونكمل.
So first, the benefits of training with RCBI. What do you expect that you'll find in RCBI, and is your professional journey going to be advanced in medical excellency or not? The answer is absolutely yes. Why is that? Because there is unique curriculum. So you have access to a unique comprehensive curriculum for your training. I want to elaborate on one important thing here, that the curriculum is developed by your trainer. So there is general specialties like internal medicine and endocrinology, for example, like my specialty, but there is special interest. Like me, I had special interest in diabetes technology and reproductive. I already had training in medicine and endocrinology. So they developed a special curriculum fulfilling my goals. And at the end of the year, I was meeting the clinical lead and my supervisor many times, and they told me before I come to Ireland, they were discussing and developing the curriculum together and sharing the plan of my work and where my training will take place. So this is a strong point to the program. They put too much effort in making your experience very specific and excellent to achieve your goal. On my final year, they start to give me leadership roles, and I work almost as a consultant. So they were preferring for me the advanced cases, and when you gain trust, we're working in the Irish hospital, they will treat you as working consultant, and they will give you more tasks of a senior doctor. There is advanced skills and opportunity to learn advanced skills that is highly beneficial for health services, will help you also when you go back. So they know which hospital you're working, and they will equip you with the skills that is important for you. An example of that, like if you are training in the cardiology department, you will have doing echo and transesophageal echo. They will train you that you can do it by yourself. For example, the training program of cardiology in Saudi Arabia, if you are starting new in a F1 level first year, most of the echo you will do reporting, but transesophageal echo you will be supervised or helped by the consultant. In Ireland, they are expecting that you know how to do the procedure, and they will give you a list of patients. So you have to practice before you going, and if you're not, you can request from your trainer. You'll be attached for like 1 month of training in echo, and you'll master this skill. Other example, you're Dr. Saya, you're doing pediatric ER, صح? Correct?
صحيح.
So pediatric, there is a high demand in Saudi Arabia in the private hospitals for pediatric ER.
أيوة.
What skills you can learn is like bronchoscopy, صح?
أيوة, نعمل حتى invasive procedures, everything. We are like actually since day one, they was expecting me to do everything. Like yeah. فكان صراحة الجميل البروسيجرز، قوة البروسيجر تكون أقوى، خاصة في التخرج من برامج الآيرش صراحة.
ممتاز. غالبا البيدياتريك ER يجوا inhaling or ingestion of foreign body، صح؟ So you need this.
هذا يعني أمس كان الهالوين وكنت شفت الهالوين، فلكم تتخيلوا الأشياء اللي جات في الهالوين. ما باقي حاجة ما جات.
Yeah, so this is an advanced skill and they are trusting you and give you a hands-on experience. Now, professional growth. So the Irish doctors are very friendly, and the Royal College of Physicians of Ireland, they are hosting many programs and public education and hosting public talks. and doing many collaboration worldwide in the United States, in Saudi Arabia, in the Gulf region. So you develop in many fields for your professional life, or for your also as educated person. So it is a structured and supported clinical learning. Experienced trainers, most of them are trained in Ireland and in UK and in the States. I know one consultant, she was working 10 years in the United States as academic staff there, and she came and I think joined Trinity University, and she's working also working in the hospital. Also, many doctors are going to the States, giving strong lectures. They are worldwide known names, and working in Galway University or UCD in Dublin. Also in RCSI عشان أكون شامل يعني موازن بين ال RCBI و RCSI. There is one doctor who is leading the medical education in all Europe. He's well known. I think his name is Dr. Castello. So you might receive many emails. So this is how Ireland is famous in the medical education. Hands-on experience, enhanced skill, and there is supporting features. There are taught programs and study days. The study days are very important. Now, if you don't in advance do a good scheduling for the study days, you might miss some study days. In my first year, I attended all the study days, 100%. And the second year, there was shortage in the staff and the fellows and the registrars, and they all want to attend. So you have to give and take, right? So it depends how you communicate with your colleagues and the hospital you're training in. This is another advantage of coastal education. So they provide many services with your English language booking or passing the exam. They can train you. The requirements before you arrive to Ireland, and they help you on the visa and the special visa. Doctora, so I have, during my presence in Ireland, many doctors, they came, not in the RCBI, but other colleges, they came without consulting coastal education. They had problem in the visa, and they have to go back into Saudi Arabia and to come. So from this lecture, I just want to everyone to know about the services, and they can apply to the right visa. Okay. Also, they can help you on the accommodation. The accommodation is a challenge, real challenge in Ireland. جدا يعني السكن كان جدا صعب. أنا رحت بعد كورونا، قعدت شهرين في الفندق. أعتقد أنا من أطول الناس اللي قاعد أدور على سكن، يعني 60 يوم، مع إني بدأت شهرين قبل ما أروح، بس كان وقتها بعد كورونا، وكان المنافسين يعني كل طلاب الجامعات بدأوا يرجعوا ثاني إلى أيرلند، فكان السكن جدا
بس صراحة كابليكيشن جدا رائعين يعني في كل حاجة صراحة. يعني كانت تتواصل معك من day one، حتى إذا تأخرت الطيارة، حتى السكن، حتى كل حاجة، يعني صراحة رائعين يعني.
ممتاز يا، ويستاهلوا التقدير صراحة. يعني حتى زملاء من الخليج برضو ساعدوهم كثير. كاس إديوكيشن ممتازين. حتى بعد التخرج ترى ممكن يساعدوا في أشياء اللي هي نقل العفش، الخروج، تكفيل الحسابات في البنوك، الأشياء هذه.
حتى دخول الأطفال المدارس، أي حاجة زي كذا هم يساعدوا فيها طبعا. أنا حتى قطوتي جبتها من السعودية وساعدوني فيها.
ما شاء الله.
والله
طيب.
ما قصرت معي يعني.
ممتاز. So they establish school and child care. طيب. So for all the current trainee or the future trainee. So لما تبدأون you have to start right. إذا بدأت بداية صح تمشي أمورك very smooth. لو بدأت باجتهاد شخصي تفضل تتعلم من كل خطأ في المسيرة. فالوقت محدود، يعني غالبا يكون training في one hospital is 1 year and you have to change. So how to start right? First thing, when you arrive, before starting, go to the RCBI. There is complete guide and support. There is a support team. When you're starting the training in the hospital, they will check on you in the first few weeks to make sure that you're smoothly getting into the system. So know your key responsibilities as a trainee, and there is action points you must do at minimum to success in your first year or second year. So always refer to the curriculum. Know the requirement of the meeting, because you have to plan your meeting that requirement in advance before the end of the year. Set your goals. So you have to know your goals. Before in the interview, you have your goals, okay? But when you arrive and start the training, always set your goals, and your trainer should know each step you're doing. So there is every 3 months you should have training with your you have a meeting with your trainer. So be engaged with your trainer. The trainers are working in many hospitals. They can be busy, and you are working with a different consultant during the service. So every 3 months you have to schedule appointment and sit with your trainer in a friendly way, and explain to him your achievements, your progress, and what you are needing to fulfill the goals. Mandatory education. So there are educational activities and study days throughout the program. No one will tell you go to that or that, because they are mature enough. So you have to know the mandatory education days. Now I'll explain to you the curriculum. So my curriculum was a special interest in diabetes technology, reproductive endocrinology. It's a little bit different than this one, but I had this one from the website, and it's give you a general idea. So there is minimum requirement. So you have clinic like diabetes, diabetic obstetrics, ophthalmic, renal. So ophthalmic in my hospital, there was no ophthalmology clinic. You have to, in advance, to book 8 clinics to go to a different hospital to achieve this goal, like Royal Victoria Hospital in Dublin. Now, the consultant, everyone in the SBR scheme, we mean by that the Irish trainee who are specializing. So it is a specialized registrar. They have this requirement, so they will have booking also, and you are sponsored. You have to fulfill that. So sometimes they cannot accommodate all the trainees. So you have to, in advance, to book to work for that. Now, if you have like 8 clinics, but you had more clinics to attend and you enter it in the curriculum, it will be a bonus for you, okay? Now, the exams, what exams you're expected to do? So بداية أول ما بدأوا الفيلوشيبس، دحين فوق يمكن 10 سنين، 2015 بدأوا أتوقع الفيلوشيبس يعني على ما أذكر. فكان مطلوب إنك تخلص MRCB recommended MRCBI قبل ما تبدأ الشغل في المستشفيات. بعد كده اتفاقيات قاعدة تتطور، وصار دحين لو عندك مثلا السعودي بورد أو الأرب بورد، ممكن MRCBI ستيب 1 تعفى منه، تبدأ على طول في الكلينيكال، بعدين MRCB ستيب 2 والكلينيكال. لو عملت هذه تقدر تشتغل في أي مستشفى لوكم ترى، وتاخذ اكسترا كولز أو اكسترا لوكم you can with the HR discuss maybe you can get paid. بالنسبة للفيلوشيب في requirements، بس في السنة الثانية أو السنة في فيلوشيبس دحين 3 سنين. السنة الثالثة أو الأخيرة أو الثانية لازم تسجل الاختبار، مثلا الرويال كوليجز اللي في اليو كي، فكل كوريكولم مكتوب ايش الاختبارات المقترح أو المانداتوري. طبعا ما لا تستنى للديدلاين، لأن أحيانا السيتس تخلص قبل الديدلاين. فمن بداية من بداية السنة حاول تشوف الأوقات اللي يفتح فيها، غالبا فبراير أو كذا. في شيء ثاني، الار سي بي اي رويال كوليج في شيء عندهم شيء مرة ممتاز صار. ممكن تسوي كانت اختبارات في مراكز حقت اليو كي، ما زالت في مراكز، بس بعض الاختبارات حقت الرويال كوليج ممكن تسويها من الديسك في الهوسبيتال او من عندك في البيت، بس حتكون مشغل الكاميرا و they on your own device you can do remote exam. اليوريبيان اكزامز، يوريبيان بورد، هذه معلومة يمكن كثير ما يعرفون، ترى المشرف عليها الار سي بي اي، واللي يقوم عليها بالتنظيم لها ار سي بي اي. طيب فهذه الاشياء يعني كلها اكسترا لو قدرت تعملها تصدقني. والتدريب وفي يعني الاكزام، اذا انت ماشي على الكوريكولم ترى بتكون قوي اكاديميا وبتحصل تعرف تحل الاسئله حقتها. الاسئله مو مجرد ام سي كيو، ترى من الريل براكتس. فايف يور براكتسينج with the Irish system you should pass. الارش سيستم ميزته انه يجمع بين اليوريبيان واليو كي واليو اس اي، فمتوازن بينهم جميعا. طيب الريل hands on experience often I think I am very sure it's the best teacher. Um, and you have to step out of your comfort zone. في أيام كنت أروح مستشفيتين، عيادة طويلة في نفس اليوم أروح مستشفى ثانية في عيادة طويلة، بس كنت شفت كمية كبيرة من المرضى، فكانت هذه مهمة لي، لأنه reproductive endocrinology أحتاج مني شغل كثير. صرت أحضر مع لوبي جايني بالإضافة للإندوكراين، بس هم تفاهموا رغبتي وساعدوني. النقل من مستشفى لمستشفى في نفس اليوم، أحيانا الببليك ترانسبورتيشن يكون بطيء ياخذ ساعة، فكنت أنا آخذ أوبر أو تاكسي. إنهم ميزتهم في أيرلندا إنه لهم خط خاص فتوصل. فمثلا في بابليك ترانسبورتيشن ممكن آخذ ساعة، لكن في 12 minutes باي أوبر. كنت أسوي كذا، ولقيت البروفيسور اللي معي كمان تسوي نفس الشيء لأنهم مضغوطين في الشغل. ف... طيب ليه ما أخذت السيارة الخاصة حقتي؟ لأن المستشفى كانت في السيتي سنتر، وبصراحة جدا صعب المواقف في السيتي سنتر. ولما كنت أروح في بداية الأيام كنت أشوف الناس تقفل على بعض في المواقف، أسهل شيء عندي خلاص ما أفكر آخذ أوبر وسهل الموضوع. طيب ايش ثاني ممكن ريل هاندز اون اكسبيرينس؟ انا كنت في الانسولين بامبس اقعد يعني اخذ ديتيلد هيستوري من افري بيشنت، وما شاء الله كثير منهم كانوا متعلمين ومركزين في البامب والسنسور. فكنت اسالهم عن الاشياء، الهايبوغلايسيميا هنا صار ايش تفتكر قبل اسبوعين، فبعضهم كان يفتكر. فكانت عام 2022 او 23 كانت البدايه، وفي بيشنت تعلمت منه قلت له هذه ريل هايبوغلايسيميا ولا لا، فكان هو ينام على السنسور كذا، قال لي لا انا كنت انام عليه وكذا. وبعدين هي من يعني الضغط الشديد على السنسور يسوي ممكن بلد برفيوجن يقل، فتبان كأنها هايبوغليسيميا، but it's not true hypoglycemia. الحلو في الموضوع أنا دائما متصل بالاندوكراين سوسايتي في الستيتس وفي بورد ريفيوز. فالسنة اللي بعدها رحت لقيت سؤال عن نفس السيناريو هذا. يعني تعلمت من البيشنت. فأول مرة يعني كانت إنه من قبل ما أحضر بورد ريفيوز وكذا كانت عندي الإكسبيرينس، وكانت حالة مرت علي. كانوا في دكاترة أكبر من كثير وكانوا يحسون إنها معلومة جديدة يعني. فهذه إحدى الأشياء. طيب التحديات زي ما طلبت الدكتور أن نتكلم عن التحديات. So working in new hospitals there are many challenges. صح؟ لأنك داخل في سيستم جديد. Give yourself time to adapt, okay? And you have to adapt. So don't be complainers or comparing your previous experience. Adapt to what you have and work fast and move forward always, okay? First of all, you have to know your department, communication, HR. I advise you, go by yourself to the HR. Some HR, they don't know what is the fellowship program, so they can delay your work and put you, ask you many questions forward, backward, and just go and complete it before you start. No, in the hospital there is education access. Where is the library? What education access you can have? And the health and research center if you are interested in that. Now the hospitals are complicated buildings like St. Vincent University Hospital. There is a public hospital and private hospital. The public hospital, I think it is many buildings are joined together. So if you have consultation, you have different floors, different buildings. And this is the trick I will give you. In the reception, there is a map for each hospital. So just have picture of this map and put it in a secure place. So every time you have a new consult or a new location, you have the map and you can. If you couldn't, just go to the security and they will guide you. The academic meetings, some in your hospital, you'll have different academic meetings. Just know about them and try to attend them. They are really beneficial, and you'll see the Irish trainee, Irish doctors, so you'll have soft skills developing in the way, and orientations. So RCBI is usually doing orientation in July. So who are attending this talk, so maybe he will get benefit of partial benefit as he will get the orientation. Health well-being in the hospital and in the Royal College. There is health well-being, and this is a personal skills you will develop while attending these health well-being seminars. So they can teach you skills in dealing with anxiety or stress. So I recommend if you have time, just from time to time, attend these health well-being. Weekend rounds and leaves, try to attend it and try to arrange it with your colleagues and program director in advance. So other challenge you can have the clinic times. Some clinics starts at 9, some at 2 p.m., some at 1:30. So it's not fixed. Try to know the clinic time. The inpatient covers and consults. It's different from training or working in Saudi Arabia. So each hospital, they have their own system. On calls, weekend rounds, overtime. If anyone has a question of overtime, weekend rounds, he can ask me. Other thing you might find challenging, dealing with families, news, genetic counseling. So they have different genetics, right? Different rare diseases. So they expect you when you are coming to the clinic or to the bedside, you are know about the details about the disease and the genetic disease. So, and you know what's already on the file. So be prepared for that before consulting the patient. Outside labs, I mean outside the hospital, regional lab or international. So in St. Vincent, there are many labs. We can, there is collaboration with the labs in UK. When I worked in hospital in Riyadh, they are usually doing genetic testing with Mayo Clinic, but in Ireland they can do genetic testing, but some hormonal profiles it was sent to UK. So know how to communicate and how to track the results. Referrals, how you do the referrals. Sometimes if you want to do urgent referral in other hospital, you can plead the on-call doctor in the other hospital from your own hospital, okay? If you don't know, just contact the general desk at that hospital and ask them to communicate you with the doctor on call. Do you have any other communication tips, Dr. Sajja? Because you're in ER, so I expect that you know more of the communications.
Usually we bother the others. Multiple calls, multiple pager till they'll answer. But actually, the good thing that actually our referral when it came, the good thing that they already start the system. So we already have a Symphony system now in our emergency. So we put the referral on the system and we start calling them.
Okay, and if you are transferring to other hospital, what you?
Yeah, it's the same. We call them, but usually it's between the nurse, and we call and just give them a call and they will answer. Pediatrics is easy peasy. It's not like that.
Okay. Admissions and handover, just know how is the team is communicating with that, because I covered some consults, so the admissions, usually I'm doing fellowship, so I'm not responsible for the admissions. But when I covered for a colleague one time, I just learned that there is in the St. Vincent, there is general admission under the medical team. So they have a cloud system or a specific email for all the list. So whatever on the night, you have to write it there and hand it over in the morning. Now there is a NCHD. This is the I think unique to the Irish system. It means non-consultant health doctor. So any trainee or fellow or resident or SHO, senior house officer or intern, so they are considered NCHD. There is orientation. In my hospital, there was orientation folder for the endocrinology and diabetes. So it explains all the tasks we have to go through. Now طبعا ممكن اغلب اللي يكونوا حاضرين الان في الاندوكراينولوجي وكذا، بس هذا مثال اندوكراين ودايابيتس. You can apply it to any specialty, okay, in the RCPI. Like in my department, don't freak out of what is written, right? Just an example, and I will tell you how to solve it. But my goal in this slide is to give you an idea how is the work done. So Monday, each Monday, there is a meeting, and there is a bone clinic starting 8:30 every third week of the month. Okay. Before that, there is also a ground round in the medical in the main conference for medical department. On the afternoon, there is another general diabetes clinic, and there is consultation you have to go. On Tuesday, I was going to other hospital for reproductive. In the same hospital, there is DEXA scan clinic. On Wednesday, there is two diabetes insulin pump clinics. In the morning, there is type 1 clinic. There is Every fourth Wednesday of the month, there is young adult clinic. On Thursday, it is the longest day in the department, from 8:30 to 2:30. It's booked for our clinics. So second, fourth, you'll have pituitary gonadal clinic for endocrine, thyroid, general endocrine clinic like osteoporosis, bone health, electrolytes, adrenal. And there is complex thyroid clinic every 2 or 3 months. Dr. Karamora is very advanced on this specialty. So she have the rare thyroid disease and complex thyroid disease in that clinic. And they are expecting the full team because it is a very long and large clinic. On Friday, my supervisor, Dr. David Slattery, and I was attending with him the diabetes and insulin pump clinics mainly. His endocrine clinics in St. Michael Hospital, so it's a different hospital. On Friday, there is also Prof. O'Toole. He's a gastroenterologist and known for neuroendocrine tumors. So it is the neuroendocrine tumors, it is collaboration with many departments, gastroenterology, endocrine, and radiology and radiation oncology. So there is a meeting for this and waiting list in the clinic. So it is on the same, running on the same time. So the start times, you have to know which start time in the morning, and all the patients are discussed, new patient discussed and reviewed by consultant. So it is very complicated. What is the tip to solve this problem? Anyone can share? It is very simple. So the tip, like this one, I had my schedule and the times, because I like attending AM this clinic in the afternoon, this meeting I'll be in this place. Endocrine club, it was in the evening time, so I left it blank, and I explained to my consultant and trainer and the clinical lead in the RCBI, that is my schedule. And there is different things I did in different times, but this is just an example. Do it and write it and leave it on your desk, because you will be lost on me in many times. Like some clinics, every 2 or 3 weeks, you can, mix the times and miss the clinic or be late. Just have your own schedule, okay? So working in diabetes clinic, there is not in the chart sign Timex. You have to update this and sign it and return the file to the desk. Don't leave it outside the clinic. There is a dictation. Any new patient, generally in Ireland, any new patient, you have to dictate a letter to the GP. All right? And if you didn't attend the orientation, you'll miss this point. Any patient you are discharging, also you have to write a letter to the primary care or any major change in the therapy. So if you're admitting the patient or changing a therapy, you have to write a letter, right? There is nurse-led clinics if you want to refer for, like in diabetes, we have a follow-up in 6 or month or 1 year, but you want to book the patient for earlier, like 2 months or 3 months, you can refer to the nurse-led clinic, but you have to communicate with the nurse and to schedule the appointment and hand her the referral form. The dietitian review as well, they will attend you in the same time in the clinic, so you can refer the patient that needs. And just know if the patient really needs, you have a clear reason of consultation and the referral. Like if you're doing carb counting, referral to educate about the carb counting, make sure that the patient will have time and will to attend the carb counting teaching programs, okay? Follow-up appointments. So there is a slave. You'll have orientation in the department, but this is just an example, what to expect when you start the training. All reports from the glucometer can be uploaded in a system in the reception in the clinic, and you can access it from your desk in the clinic. So sensor sharing, they usually share the information before coming to the clinic. You can review the insulin pump reports and sensor reports. There is codes for Libri review, Dexcom Clarity. This is a technical point. They send or curling. Just know the code before entering the clinic, so you'll be ready to access the reports. Okay. Another technical point, before, like for me in diabetes technology, before starting CGM, continuous glucose monitor, there is it for every patient or not? So at the beginning, 2022, 2023, it was for type 1, type 2 diabetes. I can give them CGM. But again, HSE, it's like the Ministry of Health in Saudi Arabia. So they update the criteria. So just know the criteria and what is the updates about that. Letters, usually it was dictated and you can over the phone. Now they are using T-Pro program. You can do it on your mobile phone, and then you can sign it electronically. So know the system in the hospital you're working in. Another thing is the virtual chart clinic. There is virtual clinic. You will have the medical file. So just read it before calling the patient and discuss with the consultant if you need to change the treatment or the follow-up. And this is another hint for the trainee. Before the patient leaves, just in your mind, know what should every patient has, okay? So they should have a prescription for the next for the next appointment, what platforms they should have, urine bottle if you're doing a urine test, okay? And OBD annual review. Appointment for them, how you do it, and make sure you go to the reception and they have it. High-tech hub, so you can set up online for e-prescription in the hospital. So this is some drugs are only high-tech hub, so only specialized doctor can prescribe it. And if you have extra work signing result, you can always divide it up with doctors working with you, okay? Any questions on these things? Okay. Continue. All right. The consultations. So the different hospitals have different system, okay? So know who is covering the consults, okay? So you cannot do the consultation, the whole training, okay? Because it's exhausting. Usually they are rotating to other hospitals, the SPR or the registrars. Just with your trainer or supervising consultant, explain what you are going to do with him and how you are going to do the consultations for endocrine. In the St. Vincent Hospital, the consultation usually were received by diabetes consults through an exact email, and the endocrine through endocrine consults. And you should have access if you are on the surface and reply on that. you have your own email in the hospital. You can contact the IT on arrival to the hospital, and they can set up an access for you to access the consultations. Okay. Now, I faced this problem. Situation. Now, if I did a consultation and I replied and I treated the patient, or now after 3 months, I'm not on the surface, okay? And I'm already in maybe different surface area in the medical. They will contact me again through email. So if you put your name, just make sure that you have the right access, okay? Don't worry too much, but this is sometimes it might happen. If you are attending another clinic outside the hospital, you have to go to the hospital and arrange with the ER. The COM hospital, I was doing reproductive, attending with the OB-GYN, and there is endocrine reproductive, attending it also in the morning. In Lockdown, there is a hospital famous for the obesity program. So every Monday and Wednesday, I have to go. If you want to go, just arrange with the professor or the consultant. This is subject to be changed. There is a gender dysphoria clinic. It's not mandatory. They understand our culture, so they don't expect you to do these. But if you want to learn more, no. So it is not mandatory, and they are very, very understanding. Okay. Multidisciplinary teams. It is one of the best multidisciplinary teams experience I ever had. I worked in many tertiary hospitals, but in St. Vincent Hospital, so they had like for thyroid. Let's talk about thyroid. We arranged the lists before for thyroid cancer for sure, or nodules, okay? If it is a cancer, there will be a senior pathologist, okay? They're bringing the actual slide, and they have the microscopes, and you can see it also on the screen. So it will be, you will learn the histology and the cells. The radiation oncologist or the radiologist, they will put some advanced radiological techniques and images. So it is also free information, and it will help you also to expand. And the surgeons and the medical doctors will be attending. Sometimes they do collaboration with the different hospitals. Just know when it starts. Sometimes it's at 7 a.m., sometimes it's at 1 p.m. And where is the department? Dynamic testing, there is protocols. Know where to find the folder for dynamic testing. In hormones, it is complicated, so just know what protocol. Usually, they expect you to book the patient in the hospital, in the clinic, and you will withdraw the blood. So be aware how, and when you withdraw, when you take the blood, which bottle. So in hormones, we have different bottles, okay? So just know how it is done. And if you are new to the thing, the doctors usually help you and explain. Just don't feel shy to ask, okay? Especially in the beginning of the training, always ask. Now, if you have any challenge, go to the senior consultant, and he will be happy to help you, all right? So the assessment and learning methods in your training. There is ongoing supervision. There is RCBI ethics programs. You have to complete these online. There are mandatory courses. You can have like the Wellness Matters course. And there is also some programs like Leadership in Clinical Practice course. If you want to advance this skill, you know. Also, you can have courses in RSSI also, right? For example, in my specialty, if you want to train in taking biopsy from thyroid nodules, I might not find it in the RCBI. I have to book the course on RCSI. This is just an example of some chemistry hematology. In different hospitals, they have different charts. And for hormones, you have to know which one exactly, okay? This is a tip for the one who's doing research. Sometimes if you don't have a clear plan, you will have a lot of delay. This is just an example. Put your own schedule, right? 4 months, I learned that it is hard to accomplish in 4 months. Usually 1 year or more. To publish an article, you might need at least 9 months. So if anyone wants to ask about the research, you can also ask. This is a feature for having a good thing is performing audit. So audit, it is a shorter version, if we can consider it, a shorter version of medical research. It can be in different tasks, and they can you can present it in the hospital also. There is a video and online course. It is free during your training. You just learn how to do it and contact the audit department in your hospital and know when is the audit date to publish your poster. Okay. Standard of care. So you have to be always consistent and effective in assessing and treating patient problems. More than that, there is the medical council. So just learn about them. The medical council, domains for professional practice, patient safety and quality of care, relating to patient communication and interpersonal skills, collaboration with the teamwork and management. There are tasks for management. Your supervisor will be monitoring you for management, including your management, self-management skills, okay? And how much time you spend with the patient, if you are fast or slow. They will not criticize you, but they are supervising that. So just to be try to be faster when the time progresses, okay? Now, this is an important, very important topic for everyone, okay? The AI. Now we are in the revolution of AI, right? In everything. So many students, doctors, academics, undergraduate, postgraduate, they are using AI and it is causing the element. What is really interesting, I found that many doctors are using the AI for report. It's okay, but if you keep it safe. But using it to take a decision. So this is dangerous, all right? Be sure not to use AI to diagnose or to treat. It is not a reference, okay? AI is a tool to help you to do a better or faster work or to organize. But so the Medical Council in Ireland, they are having statement this year. I think there is a paper in June 2025, and there is one on October 2025. On the website, you can find it. Just know that statement. There is a briefing paper to inform the Medical Council on using AI in healthcare. It is in this year, 2025. Please read the statement. Usually, I'll give you a hint or just a snapshot. So this is your practice of medicine here, and this is the risk of patient safety. So AI use usually in data collection, administrative tasks, documentation, chatbot, talk therapy. Here, where are the problem with the patient safety? Just make sure. Clinical decision support, triage, patient monitoring. Just know to be safe and how you share the information and the rules for that. So don't do any breach for the patient information. Be sure of it. Okay. Any questions now before I proceed to the final part of my talk?
So I have a question. So what do you think of using ChatGPT? So actually, I don't know. They're using nowadays a ChatGPT. Now, you know what? The funny thing that the patients coming to me with the ChatGPT, and she said, like, you know, why ChatGPT tell me that? And they start dating us, like, you know, يصير تحدي.
Yeah,
أنت يفكر في هذا الشيء ليه أنت ما تفكري فيه؟
exactly.
بالنسبة صراحة لنقطة استخدام ال AI احنا حاليا صراحة هنا لأن أشوفهم لأن صاير الموضوع مع ال NCD كلهم فقمنا نستخدم تطبيق اسمه Open Evidence هذا إلى الآن Open Evidence AI هذا اللي يعني agree by the consultant here صراحة حقت البيدياتريك emergency لأن الريفرنس حقها يكون جاما والريسيرش وكذا.
Yeah, exactly. So always refer to the trainer and to the hospital rules. The medical council, they have guide on that. Usually it is, if you know the good practice rules and how to use the AI, it is okay. But not doing harm or breach of confidentiality of the patient.
Yeah.
And the reports, if you upload it into the AI, how you can protect this information. These
So
questions just to me.
diabetes, is there any new revolutions and everything?
In diabetes,
Yeah. I think it's now
we are using AI in insulin pumps, but there are some applications under development.
nice.
Now many applications are using AI, but in helping to the decision, but it is not approved by FDA or
Yeah.
medical councils.
Thank you.
طيب. Now, just one point in this. So before we used to have the patient is going to the Google and consulting Google about his disease. Now he's consulting ChatGPT. So be prepared. Okay. All right. Highlights. So it depends on your program. So just if you plan ahead at the end of year one, summarize your achievements. Year two, what you want to do as achievements. In year one, for example, I was nominated and elected as an outstanding fellow by RCBI. RCSI, they chose Dr. Abrar Chehri, I think. She's an ENT surgeon. And I think also they gave her administrative role in the hospital. In the residency program, they had Saudi medical resident, okay? He's from the Eastern region. You can find it in the Saudi Cultural Bureau Twitter. I think you'll find the names. I published some abstracts in the Irish Endocrine Society and exams. I applied for the British exam and passed that. Had the dual fellowship. On year two achievements, I had many achievements in worldwide international as speaker. And but I think one of the very sorry. one achievement is very close to my heart, is joining the Saudi Doctor Society in Ireland and was appointed as the president. I enjoyed administrative work with the Saudi Cultural Bureau, dealing with my colleagues, and I hope they can keep continuing the society. Dr. Sayed is really hardworking. By the end of the year, you'll have many experiences in gathering doctors and dealing with different minds. So I think it will add much to your experience as a leader. Okay. Now I had the publications in endocrine societies and American journals. So you can publish abstracts in the Irish societies or Europe, or you can go to United States or North America or Australia. I know one of our colleagues, she went to Singapore to present her research. So I was happy to attend ENDO 2024. Now in ENDO 2023, I didn't apply for the visa early enough. Now this is a hint you have to know. If you are going to Europe or North America, you have to apply for the visa. In Ireland, sometimes it might take time, okay? I received my visa after the start of the conference, but I prepared earlier, before the second year. So on there, I was a poster presenting and, have these achievements, and I learned about advocacy. So you can become endocrine or diabetes advocate or in your specialty. Now I was presenting in United States. So these doctors, you'll have stories in each conference. So Dr. Salwa Al-Aidarous, Dr. Mazin Maghrabi, doctor from Mecca, and Dr. Mahmadi, she's famous also in endocrine. So they are not just my colleagues, also they are now program directors in Saudi Arabia. So they visited me, and we had visited me and my poster. So it was really a good gathering by coincidence. It wasn't arranged. This is a famous doctor also in diabetes in Galway, professor. You might, Dr. Taya, you might meet her at the RCBI. She's well known over Ireland and United States. So she did a great landmark study on metformin and the women health, gestation diabetes, and the safety of metformin in pregnancy. So she was also awarded by American Diabetes Association for best article and best research. So do you know who are these? So this is Dr. William Young and his colleague. They are from Mayo Clinic in the United States. Dr. William Young, who wrote the adrenal chapter on Up to Date. He's well known in adrenal in the endocrine subspecialty, and many books with his name. So I met him in the United States. This is Dr. Hatonik. He's working in the Mater Hospital. He's specialized in the high endocrine pregnancy conditions and endocrine in general. So you might see him in the hospital. Okay, these are I presented for my colleagues at another conference, and this is the cystic fibrosis insulin pump. It was a unique abstract, and I had many visitors to this. Another achievement is the annual meeting of Saudi Doctor Society in Ireland. Try to arrange it next year. I invited my colleague, Dr. Shaima. She was a surgeon, and she gave a talk. The Saudi cultural attaché, Prof. Al-Fahid. Prof. Rachel Crowley, she's a clinical lead for bone health in Ireland. She was working in the same hospital. I invited her to give a talk. Sorry. All of you know Miss Cleona Martin, so she's loving the experience with the Saudi doctors, and she visited Riyadh, Jeddah, many cities in Saudi Arabia, in the Gulf region. She will support you if you need her help. She's giving a talk, was always about the programs and the new updates. Professor Donald O'Shea. I'm known Professor Donald O'Shea in the Department of Endocrine. He's teaching undergraduate, postgraduate. He's clinical lead of obesity and surgical obesity, although he's an endocrinologist, but he's famous in Ireland. You'll find many talks in YouTube, TED Talks, RTE television shows. So he's very nice. Also, Prof. Oscar Trainer, he's the head of the RCSI programs, and he was here a few days ago in the Minister of Health conference in Riyadh. So if you are a trainee in RCSI, always speak with Dr. Trainer if you need any help or any advice. Now, if during your training, just check your email and keep good communication with the Saudi Cultural Bureau. During my training, this is a program was sent through the Saudi. Sometimes you can have advanced programs, or it might not be in the medicine, but just no, there is opportunities, and if you have good communication with the Saudi Cultural Bureau and the Saudi Doctor Society, you might receive things like that. And at the end, what is success for you? Is it having a certificate? Is it really making change in the patient life, or is it doing a new family? And how do you measure your success? Okay, just be creative and have fun exploring and sharing your knowledge with your colleagues and community. Thank you.
ما شاء الله تبارك الله. شكرا دكتور، جدا جدا رائع، يعطيك العافية. صراحة فائدة ليس فقط للي حاب يقدم على برامج السكري، هي أتوقع الفائدة لجميع المبتعثين حتى اللي جايين لإيرلندا. الكثير اعتذروا صراحة، وبس إنهم قالوا إن هم أرسلوا أسئلتهم صراحة، وعندي كم سؤال، يعني تقريبا 9 أسئلة صراحة وصلتني. فراح نبدأ بطريقة، يعني راح أبدأ بالأسئلة اللي هي، وفي أسئلة مطروحة في الشات، بس راح أبدأ بالأسئلة اللي أرسلت قبل. في واحد سأل سؤال، قال هل التركيز يكون أكثر في الفيلوشيب في إيرلندا في الدايابيتس على الكلينيكال اكسبوجر ولا الريسيرش؟
كلينيكال اكسبوجر. الريسيرش يعتمد على السكيلز عليك، لكن هذا إذا قدمت على RCBI فهم سايبينها مفتوحة لك، لكن متطلب منك تسوي كلينيكال اوديت في كل سنة. اوكي، هو كلينيكال اوديت يحتاج وقت، يعني فحيكون شيء صعب. لكن إذا قدمت على مثلا زي UCD بروجرام أو سانت فينسنت يونيفرسيتي هوسبيتال مع دكتور مثلا معين، فعلى حسب اتفاقك حتكون في الريسيرش أكتر. فاعتمد أنت رغبتك الأساسية ريسيرش ولا كلينيكال أكثر.
جميل، شكرا. آخر كاتب، ما هي شروط القبول وعدد المقاعد لتخصص السكري، وهل المعدل مهم، وجودة التدريب مقارنة بدول الابتعاث الأخرى اللي جربتها، مزايا وعيوب؟ تقريبا أنت طرحت معظم يعني جاوبت على معظم السؤال، بس إنه بالنسبة لعدد المقاعد المتاحة. أنا صراحة ما عندي فكرة بالنسبة للإنترناشونال فيلو.
متغيرة طبعا، على حسب لأنه دحين الإندوكراين والدايبيتس خلوه 3 سنين صح؟ كان أول سنتين. ففي مبتعثين اوريدي على البوزيشن، يعتمد على المستشفيات. بس أتوقع يعني العدد على حسب. في الإندوكراين 1 to 2 position per year كان. بس ممكن دحين رفعوه إلى أكثر، يعني 5. ما عندي معلومات، بس ممكن تسأل على الRCB.
المعدل مهم مع إنه ما له دخل
مو المعدل المهم، المهم التريننج. إذا أنت مثلا تبى تاخذ دايبيتس لازم يكون عندك بورد. فمثلا لو عندك بورد في الباطنة يكون أسهل. لو كان عندك بورد في طب الأسرة ممكن تكون different route than the RCBI. ارسلهم وهم بيدلون. في شيء ثاني، التقديم والتخصصات على صارت متاحة على طريق صفير. زمان كنا نراسل RCBI والسبونسر ونسوي الابلكيشن. دحين على سفير وتنزل التخصصات. كانت بداية يعني زمان كانت 50 في السنة لكل التخصصات، بعدين زادت شوي 70. إن شاء الله أتوقع أنها بتوصل 80. فرنسا وإيطاليا عدد مقارب. ألمانيا أظن أكثر شوية. بس نصيحة لكل يعني اللي يبغى يبتعث، لغة إنجليزية حيكون التدريب حقك. كلية معروفة، شعب ودود، بيئة تعليمية ودودة. هذه ترى مهم جدا إنه تكون البيئة التعليمية ودودة. في كثير راحوا يعني لما كنت في الرياض أشتغل، كانوا في ناس يرجعون مثلا من أمريكا. كنت أقول له أنت في البروجرام يعني ليش رجعت كذا؟ قال لي بروجرام كويس كذا، بس البيئة ما كانت مرة يعني الضغوط كانت كثيرة وكذا، ما كان مرتاح. ف 99.9% يعني حتكون ناجح في إيرلندا.
صحيح، لأن أصلا جاء سؤال على نفس الشيء، قال لي كيفية ممكن تسأل الدكتور كيفية التفاعل بين الزملاء والاستشاريين، وهل الأجواء تنافسية ولا فيها دعم أكثر؟ فأتوقع السؤال بسبب يمكن عنده تجربة أو حاجة زي كذا، جاني نفس السؤال كذا عن نفس الموضوع.
والله شوف، إذا تبغى تكون من الممتازين حتكون في تنافسية.
صحيح.
ولو أنت منافس قوي ترى حيخلوك الليدر عليهم. حتى الآيرش يعني حيصيروا يعزموك في أماكن كثير وكونفرنس. في شيء ثاني بالنسبة للتنافسية مميز، ديبيت. فمثلا في الدايبيتس يعطوك ما يعني غالبا انت انترناشونال ما ممكن ما تشارك فيه، بس هيكون في ديبيت على توبيك معين. مثلا بطلب الهيموجلوبين A1C ولا I will use the sensor as a continuous glucose monitoring CGM متابعة الدايبيتس ككواليتي فيجيبوا ناس ديبيت. كان يعني ايش بالعربي ديبيت؟ ممكن نقول مناظرة. صح، مناظرة. ففي تنافسية وفي عليها جوائز. فلو انت روحك تنافسية دي الاشياء جميلة. وبرضه تروح اليوكي كذا مرة، يعني من ايرلند يكونوا يربحون الجوائز حتى في يوكي. فتنافسية موجودة، لكن اذا انت تبغى بس تكون مع السوبرفايزر وتكون ودود وكذا برضه بتمشي. المهم الاشياء اللي انا كنت كونسلتنت اشتغلت معاهم في ايرلند، انك تكون ملتزم بالمواعيد وتكون واضح في اهدافك وتسوي التاسك. وكمان لو غبت او احتجت تغيب تعلمهم كلهم يعني. طيب، ما تكون فجأة تختفي. الاختفاء فجأة هذا يضايق الدكاترة وياخذون انطباع سيء عنك. فدائما تكون على تواصل جيد. طبعا يكون في شخص مسؤول عن الجداول. فأنا مثلا لو كنت في يوم ما حكون فيه أو شيء، ممكن أرسل للشخص ده وبرضه أسوي CC للسكرتيرة وللسوبرفايزر أو للدكتور اللي يكون على السيرفس ذيك الاريا. كل واحد يصير عارف أنا فين، متى رايح ومتى راجع ومتى.
طيب دكتور، في سؤال بعد آخر جاني: هل يوجد رابط لتسجيل المحاضرة؟ طبعا للكل جميعا ترى راح يتم تسجيل المحاضرة، راح يتم وضعها على قنوات اليوتيوب. في أسئلة راح تكون من البول. أول سؤال بالنسبة لي: هل رأيك يكون في حديث عن تخصصات طب الأسرة؟ حديث عن تخصصات طب الأسرة أوريدي عملنا الفيرست ميتينج مع الدكتور عن طب السمنة، وراح يتم عمل ميتينج آخر إن شاء الله في الثالث أسبوع من نوفمبر. سؤال آخر: كيفية طريقة تقديم على الملحقية؟ الضمان المالي من الملحقية. سأل سؤالي.
الملحقية متى يبدأ دورها؟ لما توصل أيرلندا. إذا ما وصلت أيرلندا فأنت قبلها تكون مع سفير ومع وزارة التعليم العالي. الضمان المالي حيكون من المستشفى المبتعثك أو من برنامج خادم الحرمين الشريفين للابتعاث أو من الجامعة، على سبيل المثال لا الحصر. أوكي، فقبل ما توصل أيرلندا تكون الضمان المالي من الجهة اللي مبتعثك. بعد ما توصل إيرلندا وتفتح ملف في سفير، الملحقية تعطيك الضمان المالي.
وسأل سؤال بعد: كيف وضع المعيشة خاصة السكن للأسر؟ أتوقع أنها متقلبة صراحة، يعني ما أعرف، يعني الجميع يتكلم طبعا هو وضع السكن في إيرلندا بشكل عام شوي يعني يعتبر واحد من الصعوبات الموجودة، بس بإذن الله يعني إذا كان معك الكاسل وديكيشنز ولقوا لك المكان راح يكون بإذن الله الوضع المعيشة إن شاء الله يكون كويس. أنت عندك أي تعليق دكتور؟ وكاتب بنفس السؤال: كم راتب الملحقية؟
طيب، راتب الملحقية للطبيب المبتعث ولا للموظف المبتعث ولا لأي تخصص؟ ففي
دكتور عبد الله السكري بليز، إذا كان كذا ممكن تكتب لي بس بالضبط إيش حاب توضح.
أيوة،
آه
الراتب ممكن يسأل في الملحقية ويسأل في وزارة
صحيح
التعليم. طيب،
صحيح.
بالنسبة للسكن، أتوقع أصعب فترة كانت بعد كورونا، لكن المساكن النصيحة الذهبية لازم ترسل أحد أو إنك نفسك تشوفه. مثلا أنا من كنت في دبلن فور كانت منطقة غالية شوية، فمثلا كانت ب 2000 يورو في بعض المساكن، شقق صغيرة 2000 يورو في الشهر. ففي بنفس الأجرة هذه ممكن تلاقي شقة في عمارة توها مبنية وجديدة، وممكن تلاقيها شقة في هاوس مبني من مثلا 50 سنة، ولازم تروح بنفسك وتشوف. يعني لا تعتمد على الإعلان، أرسل أحد أو بنفسك روح شوف. السكن يحتاج وقت. لو كنت حتغير مستشفى مثلا أو مدينة ثانية قبلها ب6 شهور ترى دور على السكن. ممكن شيء ثاني، تواصل في المستشفى اللي بتروحه في الدكاترة الآيرش والسعوديين اللي يكونوا شغالين هناك، لو ساكنين قريب حيكونوا يغيروا سكنهم، فممكن تاخذ منهم السكن. يعني هذه الأشياء اللي تورد علي. لكن في برضو سماسرة عقار ممكن تسأل ملحقية ويساعدونك إذا يوصون أي مكتب عقار إنه يساعدك في السكن كذا.
دكتور عبد الرحمن كاتب سؤال: هل اختبار الام ار سي بي اي من متطلبات القبول الفيلوشيب؟ انا اللي اعرفه انه لا، لان خاصه البورد انا بالنسبه لي فقط البورد العربي والبورد السعودي كان كافي للام ار سي بي اي 1.
أيوة، غير مطلوب، بس لو عندك فرصة إنك تعمله يعني يكون شهادة فيها برستيج وشهادة مرموقة، يعني أخذها. ما هو مطلوب. المطلوب الآيلتس أو اللغة الإنجليزية.
واحد كتب سؤال بس: اللهم would you please provide us with 1 or 2 emails so we can send our questions. They want like to contact you for something.
كونتاكت مي. طيب، يعني يرسلوا للرابطة ولا لي ولا؟
ممكن تبغى يرسل للرابطة ممكن أنا حطيت صراحة الإيميل الشات، إذا أحد عنده أي سؤال أو حاجة ممكن نتواصل معه أو نتواصل مع الدكتور إبراهيم للجواب على أسئلتكم.
طيب تمام. خلاص ممكن يرسلوا الرابطة وترسلوا لي هي ورد عليها إن شاء الله.
جميل جميل. طيب دكتور، لو نبغى نختصر تجربتك في جملة واحدة كيف توصفها in general؟ هذا سؤال مني أنا.
في كل المستشفيات اللي اشتغلت فيها وتدربت فيها، بتوفيق الله عز وجل ثم دعم الملحقية الثقافية في إيرلندا، كانت أفضل تجربة آه، تعليمية حظيت بيها. وكنت أتمنى يعني إني من زمان آه، رحت لإيرلندا، وكانت يعني تجربة ناجحة وكافية، بدل ما كنت رحت دول كثيرة ثانية.
ما شاء الله تبارك الله. نشكرك دكتور، جدا جدا سعيدين صراحة باستضافتك. وصراحة الأسئلة ما شاء الله تبارك الله، معظم أصلا في أسئلة بعد جاتني بس أنت أصلا أوريدي جاوبت عليها في اللقاء. أم، صراحة ما نقدر نوفيك شكرك. أكيد في لنا بإذن الله أعمال مشتركة في المستقبل. إذا حاب تضيف كلمة أخيرة قبل أن ننهي اللقاء، أبد تفضل.
أيوة، حابب أشكرك دكتورة على جهودك، يعني جهود ما شاء الله ممتازة اللي بتعمليها اللي هو الايرش شابتر، وتجيبين الناس يتكلمون من تخصصات مختلفة، ترى جدا ممتاز. لأنه أي أحد يبغى يجي يعني أو يبغى يبدأ التدريب، يبغى يشوف الناس اللي قبله واللي مروا بتجارب وهل كانت ناجحة أو لا. أنا
هذه
لا.
الفكرة،
أيوه.
انه يعني يكون تجارب السعودية. طبعا راح يكون في الان في شغل مع الار سي بي اي والار سي اس اي، راح يكون في اوفيشال ثينكس بعد من عن طريقهم هم، راح يكون مربوط. بس الحلو انه يكون بنظرة نفس المجرب افضل. اسأل مجرب على قولته.
أيوه، وأنا لما كنت قدام تعلم بس شفت الفيديوز اللي عملوها الار سي بي اي الدكاترة اللي قبلي، فشجعتني صراحة، خلتني أخذ الديسيجن. طبعا أنا يعني فخور بكم، وأنا شايف إنه البرنامج قاعد يتطور أكثر وأكثر، التجربة قاعدة تكبر. البرامج قديمة جدا في الرويال كوليجز، بس أنا شايفها قاعدة تاخذ طابع جديد ورونق جديد، وكثير دكاترة من اللي رجعوا يعني شغالين استشاريين وناجحين. فلازم الأجيال يعني تكون النجاح في التواصل وإكمال التجربة. والكلمة الأخيرة اللي أحب أقولها إنه كلنا شركاء في النجاح. يعني تجربة النجاح هذه والابتعاث كلنا شركاء فيها، فلازم نتعاون. آه، حتى بعد التخرج لازم نتعاون مع الملحقية ومع الرابطة وتبادل الخبرات.
في واحد دكتور عبد الرحمن سألني عن الفellowship بالجي اي في ايرلندا، نصائح وتوجيهات. بإذن الله راح نستقبل أحد الضيوف، راح يكون جي اي فellowship، وراح نتكلم عن الموضوع.
ممتاز. الجي اي 3 سنين.
مم.
تعرف واحد جاسترونترولوجي او؟
ايوه، هذا قاعدين الحين جاري البحث ان شاء الله باذن الله، بس لان كثير من الاسئله جات عن regarding gastroenterology. دكتور عبد
آه،
الرحمن الضفيري هو احد الريزيدنت في السعوديه، وحاب انه يقدم وسال هذا السؤال.
ممتاز. ممكن بعدين انا اعرف في دكتور من الكويت خلص
كويس.
جاسترونترولوجي، بس بنشوف برضو زملاء السعوديين ممكن يكون احنا ثاني، وممكن تستضيفونه يعني.
ان شاء الله باذن الله. شكرا دكتور، شكرا جدا، ويومك سعيد. يعطيك العافيه مره. شكرا.
العفو، الله يسلمك، شكرا.